Well, thank you for coming out on such a nice summer evening. I don't know how many more of these we have left, huh? So I appreciate you being here. I want to thank the Cancer Wellness Center and the Leukemia Lymphoma Society for having me here tonight. And I always like to start presentations about nutrition by reminding you that nutrition is a science. It's a lot like biochemistry. So it's a science. The more we study it, the more we learn, and sometimes recommendations change, right? I'm sure you've seen in the media, whenever there's something very contradictory to what we've always heard, it's big news, right? And so when I went to school a long time ago, nuts were considered one of the worst things you could eat. They were too high in fat, and obviously we learn more about the type of fat and fatty acids in nuts, and now we know that's not the case. We still have to be careful the portions of nuts we eat, but we know they're not the dangerous food we thought they were many years ago. So, we're going to talk about 5 and maybe more components of a nutrition plan for people with blood cancers today. But if we do this again in a year, that could change. Many of the things I'm going to talk about will change. A lot of what we know about nutrition and the development of cancer is based on observational data. So studying large groups of people over time and then looking for associations, who developed this type of cancer, who didn't, what did they do, and that's not the gold standard clinical trial we like to see in medicine. So there's still a lot of work to do in this area. Now, when we talk about some of the things you can do during treatment, there we have smaller clinical trials. So when I talk a little bit later about glutamine and vitamin D, those are actually based on studies in individuals going through treatment. So I just want to clarify that, because there is a lot of confusion in the media when it comes to nutrition and some of the recommendations we hear. And even those of us in the field recognize that sometimes it's hard to decipher, am I supposed to eat eggs? Am I not? Am I supposed to eat nuts? Am I not? So, but I'll be happy to try and answer any questions you may have based on anything you've seen or read recently. A little bit of an outline of kind of what are the 5 areas we're going to talk about here as far as a plan. Healthy diet. So what constitutes a healthy diet before, during, and after cancer treatment? And that, again, that's going to be in about 10 years very individualized too, as we learn more about individuals' genetic makeup when it comes to how we all metabolize nutrients differently. There probably is not going to be one healthy diet. But kind of what does that look like? A little bit about food safety for individuals who may have a compromised immune system during treatment, or those that may be going through a transplant, a stem cell transplant, or recently gone through a stem cell transplant. A little bit about side effect management and nutrition support, because here's where we have some clinical trials of some nutrients that may be helpful, including glutamine, vitamin D. I'm going to talk a little bit about fish oil as well. So what do we mean when we say a healthy diet? And again, we have a group here, so this is really tailored to a group. If I were meeting with each of you individually, or if the dietitian here were meeting with you individually, or someone else, that would look very different based on your history, the type of cancer, the type of treatment, what other things are you concerned about, your lifestyle. But these are some general guidelines. So this is from the American Institute for Cancer Research. If you're not familiar with them, they're an organization in Washington, D.C. whose main mission is to study the role of diet, nutrition, physical activity, and cancer prevention, treatment, and survivorship. So I have their website in the resource slide, aicr.org. Great information about nutrition and cancer. But these recommendations I'm going to go through are almost identical to what you see from the American Cancer Society, all the guidelines in this area. So there's not a big discrepancy here. But this organization, this is their main mission. So they're a wonderful resource. In 1997, they first came out with it was called their first expert. I don't know if they called it first then, because I don't know if they thought they were going to update it every 10 years. But it was their report on, what are the recommendations in the area of diet, nutrition, physical activity, and cancer prevention, based on all the observational data we have out there in the world. I mean, this was not just the US, it was a worldwide effort. So they came out with those recommendations in 1997, and then in 2007 they came out with their second annual report. So they updated it based on the previous 10 years of research. The recommendations didn't change all that much. However, the things that were most interesting that changed from 1997 to 2007 was one, the emergence of the association between obesity and the risk of cancer. So that was something that was new, and we'll talk a little bit about that. And then recommendations regarding red meat and processed meat. And that was really more related to digestive cancers, but those were kind of the newer things that came out in 2007. And then just earlier this year, they came out with their third expert report. And again, not big significant changes, but I'll kind of touch on them briefly because I don't think there's anything real surprising here. But the first recommendation is be a healthy weight, and that's because the data on obesity and cancer is becoming stronger and stronger as far as the association and increased risk. In blood cancers, it seems to be right now associated with multiple myeloma and possibly non-Hodgkin's lymphoma, so slightly increased risk with obesity and those cancers. And then when the obese individuals have treatment, the obesity is associated with increased complications, potentially more toxicities with chemotherapy. So that's why the focus on a healthy weight. And I learned tonight there's a sounds like a fantastic weight loss group here that'll be starting again in January. So, do you have a question?
No.
Oh, okay. So I just want to put that out there because sometimes it's not easy to find resources.
My husband has multiple myeloma, so this would be appropriate for him as well, right?
Generally we don't recommend it during treatment, but if he's
Well,
done with
in treatment, he goes every month.
Okay. Yeah, and here I think Jennifer said ideally they want you removed from treatment, but within 2 years. But if he's on sort of
Open end.
it would probably be okay, yeah. But you would want to talk to them here. So I understand they'll be starting another group in January. It meets every week. They have their dietitian. It sounds like some mind-body, mindful eating activity, and it meets weekly. So, that's a wonderful resource to have here. Definitely, and it also increases your risk of a secondary cancer and, of course, other, chronic diseases as well. So, really a big focus here from 2007 and even more in 2018, just this year when it came out. Being physically active, I'm sure everybody's heard that. The current recommendation is trying to get 150 minutes of activity a week. That independently is associated with reduced risk of cancer. And then a lot of these recommendations are actually aimed at number one, helping individuals achieve and maintain healthy body weight, although there is rationale for some of them beyond that. So for example, eating a diet rich in whole grains, vegetables, fruits, and beans. I mean, that sometimes in and of itself helps people achieve and maintain a healthy body weight. But the other reasons for those recommendations are one, the fiber, the vitamins, the minerals. There are phytochemicals or plant compounds in those foods that potentially protect the DNA in our cells. So eating more of those foods is protective even outside of body weight. The other thing we're learning more and more about with regards to these types of food, these plant-based foods, and totally different if you eat a meat-based diet, is these types of foods have you heard a lot recently about the gut microbiome or the microbiota? Some people are shaking yes, some not so much. But there's a lot of interesting data coming out now about the bacteria in our gut. So we have good bacteria, bad bacteria. If you take antibiotics, it kind of disrupts that. But there's a lot of interesting data coming out saying eating this way increases both the diversity, so the different types of good bacteria, and the amount you have in your gut. Compared to eating more of a SAD diet, standard American diet, meat-based diet, where we don't see that diversity and we don't see these higher amounts of healthy or good bacteria. And so more and more, and the interesting thing, there are studies showing in 24 hours you can change that. So if you eat all these plant-based foods and we test your gut microbiota, you can maybe visualize how we would do that. Some people might still be eating, so I won't talk about it. But you can test the microbiota and see this diverse, rich, good bacteria, and then go 24 hours eating primarily meat, and it changes. So you can impact it that quickly. And we're starting to see some interesting data emerging about the gut microbiome and how that may influence response to different chemotherapies and the incidence of toxicities. So lots of reasons to eat the whole grains, fruits, and vegetables. And again, I know this is nothing new, but we're starting to learn more reasons why it may be important to do that. And then some of these, like limiting consumption of fast foods and other processed foods high in fat, starches, and sugars, that's really from the body weight standpoint. Although if you think about some of those foods, you're also missing out on a lot of the things we talked about, why you want to eat the other plant-based foods. Red and processed meats, more for colorectal and those types of cancers. Sugar sweetened drinks, it's the body weight issue. Limiting alcohol consumption, actually in the 2018 report, and more data is suggesting there may be no safe level of alcohol consumption. But if you do drink, the recommendation is limiting it to 1 for women or 2 for men. Don't use supplements for cancer prevention. We still haven't been able to replicate some of the things we see with food with supplements. Not to say there isn't a place for supplements, because I'm going to talk about a few of them tonight, but not necessarily for the cancer prevention effect.
Can I ask a question?
Of course.
Back to the sugar.
Mm-hmm.
I was under the impression that sugar in any form can feed the tumors.
Yeah, that's a very complex statement that we hear. Sugar feeds cancer.
Because when
Sugar
you
feeds
take
tumors.
a PET, you take glucose before that, and then the areas where you have tumors light up.
Right.
So the radiologist technician was the one who first told me about that.
Yeah. The challenge with that is your healthy cells need everything the bad cells need to survive, and the bad cells are using them faster, and so you can't necessarily starve the tumor without potentially harming the host. That being said, we are learning more about it may not be so much the sugar from a standpoint of cancer risk, but the levels of insulin. So when you eat sugar, your pancreas secretes insulin to help bring the sugar into the cells to be metabolized, and it may be those elevated levels of insulin that actually can cause damaging changes to cells. So yeah, I'm not saying sugar's definitely not a good thing to eat, but it's a very complex. There are a lot of different pathways that that can be challenging with that approach. Now again, so this recommendation here was primarily as it drives weight. That the number one the number one source of excess calories in the U.S. are sugary sweetened beverages. So that's been pretty well documented. So that's the reason for that rationale, for that recommendation. That being said, there is interesting data coming out and trials underway with the ketogenic diet, if you've heard of that. So that's a very low carbohydrate diet, much higher in fat than we typically, would meet these guidelines. I haven't seen anything in relation to blood cancers yet, but glioblastoma, potentially with certain drugs for breast, head and neck, and lung cancers. But again, 10 years from now, it could be different. We may see it studied in blood cancers as well.
Did the keto causes those, or that the keto helps?
It may help. It may help the effectiveness of some drugs, yes. Okay. So, but again, it's very, very preliminary data, a lot of preclinical data in animals, and so we still need to see what happens in humans. But yeah, I'm glad you asked that question, because there are other reasons to avoid sugar and to avoid eating some of these other things, even if your body weight is perfectly healthy. So yeah, I'm glad you brought that up. Thank you. And for mothers, breastfeed your baby if you can. That's kind of something, you may or may not have control of at this date. But for young women, that does seem to be protective for breast cancer. And then after a cancer diagnosis, follow these same recommendations if you can. And we're going to talk a little bit about during treatment. I mean, sometimes it's not that easy to eat plant-based foods and not potentially get some sugar, just to make sure you're maintaining your body weight. And then the obvious ones: don't smoke, chew tobacco, avoid excess sun exposure. So none of that changed. So what does a healthy diet look like before, during, and after treatment? This is just an example of the Mediterranean diet, but that is very consistent with those guidelines we just went through, where the majority of your diet is whole grains, vegetables, fruits, more beans for protein, less animal foods, and these things like dairy products, red meats are much less often. Is that not surprising to anyone? Okay. Now, a ketogenic diet would look very different than this. You'd be eating, so the problem with the ketogenic diet, too, is it's very hard to follow. I mean, most of the studies that are underway end up closing because people can't stay on the diet for an extended period of time. So the question is, how do you make it easier to get the benefit of the ketogenic diet, and maybe and have people not have to be living on avocados and coconut oil and those types of foods. And then during, ideally, as it says, if you can follow the same type of approach, that's ideal. But we realize that's not always realistic or possible. And similarly after. So it doesn't necessarily change other than managing side effects. Does that make sense? So, again, I don't think a lot of this is new. So when we get to the vitamin D, glutamine, we'll spend more time there. But, a healthy diet potentially can help with managing side effects. Some of these diet approaches, actually, we see less side effects when people eat healthier diets. Replacing blood cells. So during and in between treatments, you need protein and some of these nutrients as building blocks to make new red cells, white cells. A lot of times people ask me, how can I boost my immune system? Like, eat good proteins, eat lots of fruits and vegetables, because that's the first thing you need to make new blood cells. Support, I mentioned the immune system. And then eating this way after treatment can help with some of the later effects we see from like stem cell transplants, for example, and other treatments for blood cancers, so metabolic syndrome, high blood pressure, the things that even Americans that haven't gone through cancer treatment have a challenge with. We talked about the focus: vegetables, beans, fruits, whole grains, low-fat yogurt and kefir, and that's primarily for the probiotics, which can help with that gut microbiome, giving you good bacteria in your digestive tract. Lean proteins of things like fish, maybe chicken, but ideally we recommend more vegetable proteins: beans, legumes, lentils, and then healthy oils, small amounts of healthy oils: canola oil, olive oil, fish oil, walnut oil, so very small amounts of those. I think we kind of hit on this. Plants ideally now, again 10 years from now, there may be something like the ketogenic diet that's recommended with certain treatments, certain cancers. Definitely not something that we recommend across the board at this point. Emphasis on fiber for the gut microbiome. Again, fiber actually provides prebiotics. Have you heard of prebiotics? I talked about probiotics, some yes, some no. Prebiotics are actually the food that the probiotics, that the healthy bacteria need to survive in your gut. And may be more important than the probiotics. So the focus on fiber, I think everybody knows it maybe helps you with regularity, and soluble fiber can help actually with diarrhea. But from the gut microbiome and potentially changing how we respond to therapy and side effects, another reason to eat the fiber. So these are just some recommended portions, again, highly individualized, but everybody I'm sure has heard that at least 5 servings of fruits and vegetables, probably more like 9, is what would be ideal for most people from a standpoint of the gut microbiome. Maybe 2 to 3 servings of the dairy products, ideally yogurt or kefir, for the same reason. 4 to 5 servings of beans a week in place of meat if possible. How many people in here eat beans at least once a week? Okay, good number. So what we usually say is so some of you maybe start once a week if you can in place of meats, and then increase 1 day a week as possible. So you're eating more beans and less meats. Okay, and then at least 2 servings of fish a week if you can. But I'm going to talk more about omega-3 fatty acids in a little bit. So if you don't like fish, there are supplemental ways to get it as well. So normally what happens when we talk about eating 5 to 10 servings of fruits and vegetables and all these plant-based foods, a lot of times the first question I get is, what about pesticides? So I usually ask a question back when I get that question. What do you think is the #1 source of pesticides in our diet? That's not #1, but we're going to talk about it because it is a source. But what do you think is the #1 source that we ingest?
Meat?
Meats and dairy products. Yep, because they accumulate as they go up the food chain. So, when we talk about, do I have to buy organic? I say, well, one, if you switch to a plant-based diet, you've automatically really eliminated or reduced your source of exposure that way. But if you are eating red meat, dairy products, if you can do organic, you minimize exposure there as well. But fruits and vegetables are a source, and if we're asking people to eat 5 to 10 servings a day, one of the things we recommend to, I guess, decide whether or not you want to buy organic, because we work with individuals where sometimes financially that's not possible, and so then we talk about proper washing and trimming and rotating what you eat so that you're not exposing yourself to the same thing over and over again. But if finances aren't a barrier, one of the resources is the Environmental Working Group, and that's in your resource list also, ewg.org, I believe it is. Every year they put out this list of the dirty dozen, and you get a bonus sometimes too, so 13, a baker's dozen, of what fruits and vegetables have the highest pesticide residues on them. They used to do it before washing, but now they actually do it in a really good way where it mimics what would probably happen in our homes. You know, they're measuring it based on how somebody would typically consume it. And so these are this is the produce where you may want to spend the extra money to go organic, again, because you're going to have a higher exposure. Yes?
Does it help? I have that vegetable wash. I use that on everything, you know, that I purchase, even the organic. Does that help at all?
Yes, washing and, you know, friction as you're kind of washing and scrubbing removes quite a bit. Peeling, so if it's something that can be peeled, like the outer leaves of greens, and then again, like we say, is just rotating, so you're not eating the same thing every day if you are getting exposed to something. But yeah, washing is your number one. If you can't do organic, washing is your number one way to protect yourself.
But I heard recently that some of the pesticides have penetrated, it's not just on the surface, so that you can clean it off, it's actually...
Some do, yeah. So I mean, again, if you're concerned about pesticides, the safest way is to go organic. But if you can't, or sometimes the shock value of the cost, washing removes a good amount. Yeah, from most produce. Yeah. And then hot peppers was kind of a bonus this year. So. And then they also put out the Clean 15. So this is the produce where the lowest pesticide residue was found. So again, these are ones where you may not have to spend the extra money to go organic. I find for people it's money, and some people it's visual. I work with people who are visual eaters, and they're like, if the organic produce doesn't look as good, they say I'm not going to eat it. So again, the benefits far outweigh any risks that we know of now. So I'd much rather somebody be eating it than not eating it because they can't afford, or they can't, they don't have access to actually good organic produce. And here in the Midwest, we're kind of getting into that season where it gets a little harder to find a good variety of produce. I know the farmers markets in this area are wonderful from an organic standpoint, and purchasing co-op boxes of organic produce. But in the winter, it's a little tougher.
Do you know where bananas would fall?
Bananas are somewhere in between, so they're not necessarily the dirty dozen or Clean 15. And kind of to your point, the peels on produce is interesting, right? So you're probably removing quite a bit. Washing it first. Actually, with produce, you really should wash even the ones we peel or cut. We should wash it first from a pesticide and a bacteria standpoint. But yeah, you're peeling it, so you're probably really minimized that way as well. But yeah, so they just do the kind of the worst and the best. So bananas are probably somewhere in between there. But yeah, remember, meat and dairy products are bigger concerns. So again, food safety, this is kind of like 101, but I mean, millions of people, and I can't open up my email any day lately and not see a fairly major foodborne illness outbreak from restaurants, stores, whatever it may be. And it's making healthy people sick. So for individuals who are going through treatment or a stem cell transplant, for example, they have to be even more vigilant in this area. So cleaning's an obvious one, cleaning the areas you prepare food regularly. Sometimes we recommend a tablespoon of bleach and a gallon of water, and kind of cleaning surfaces that way every now and then as well. Cutting boards, don't use the same cutting boards for animal products or things you're going to cook, and produce that you're not going to cook. Clean those well as well. Keep food out of the danger zone. Have you heard that? Do you know what the danger zone is for food? Between 40 degrees Fahrenheit and 140 degrees Fahrenheit, food can grow bacteria pretty rapidly. So that's the reason why you hear, put food in the refrigerator as quick as possible. And when you reheat leftovers, heat it above 140, ideally to 165, but at least get it above 140 to kill any bacteria that may have been in there. I came from a family who, I guess never heard of this, and fortunately I don't know that I got foodborne illness, but one of the things that came up the last time we did this program is, well, what do you do when you cook a big pot of food? You don't want to put it in the refrigerator because then everything in there gets warm, and so the best way to cool food quickly before you store it is put it in a bath of ice, or ice and water, and then, get it in the refrigerator, either in smaller containers or in that container within an hour or two. This time of year when it's hot, an hour, but definitely no more than 2 hours, because then you're in that dangerous zone. When in doubt, throw it out. Okay. And then certainly avoid raw, undercooked and underpasteurized food and beverages. So side effect management during treatment, some of this may apply, even to us as we're healthy individuals as far as beneficial nutrients. It seems obvious, but we always recommend people take medications as prescribed from their oncologist. So it's very common for us to see individuals that might be having a side effect, and one of the first questions we'll ask is, are you taking fill in the blank? And often they're not. The other thing about, how many of you have worked with a dietitian? A couple of you, okay. And I don't know if you had this experience, but one of the benefits of working with an oncology dietitian is sometimes they may think of a medication that, or could recommend something to suggest to the oncologist if it hasn't been tried. But more often than not, it's not being taken, to get the most benefit. So we talked a little bit about probiotics from a standpoint of just maintaining a healthy gut microbiome, but they can also be helpful for managing diarrhea during treatment and or constipation. So food sources are often the easiest way to get probiotics: yogurt, kefir, kimchi, sauerkraut, miso, fermented soybean paste, so miso, tempeh, which is a fermented soy product. But if you can't do food sources, sometimes a supplement is indicated too. And I don't want to go too much into supplements, because with probiotics, it really is individualized based on what you're using it for. So if it's, again, I'm used to talking about diarrhea, but if it's diarrhea, it's one strain, or a different strain than if it's constipation. So ideally, food's probably an easier way to get it because you get a good variety. But if you need a supplement, it's always good to work with your oncologist or someone from your healthcare team, because the literature is pretty clear. Depending upon what you're using it for, you may need a different strain, a different amount. And then fiber. So fiber is an interesting one, right? So insoluble fiber, which doesn't mix with water, is what actually helps with constipation. And we see constipation with some of the chemotherapies used for blood cancers. So there you want to use more of the potentially whole grains. Sometimes we'll even use wheat bran, but insoluble fiber for constipation. And I think that sometimes people have a hard time with taking fiber for diarrhea, but soluble fiber can actually help with diarrhea, help form the stool. So either food sources or supplemental sources. So again, if you have specific questions about these things, I can answer them either in a group, or if it's more comfortable, I can answer them one-on-one afterwards.
So soluble
is good, can help manage diarrhea.
but what is soluble?
So soluble would be things like oats, barley, rice, bananas. There's your banana, so bananas, applesauce, tapioca. And then there are some soluble fiber powders, like supplemental on the market, that you can just mix in, water or juice. Actually, what we use a lot of is, anybody in here make jelly? No, I don't either. So, but the pectin that you use to thicken jelly can do the same thing for your digestive tract. So Sure Gel, it's the only brand I know, but Sure Gel is something you can find on a grocery store shelf that people use to make jelly, and we'll have people put that in smoothies to try and help with diarrhea. So does that give you enough examples?
And then the insoluble would be?
The insoluble, the biggest source of insoluble fiber is whole wheat bran. You get it from some vegetables. some fruits, yeah. And we talk about it like it's very distinct, but most foods have a little bit of both. But, you know, the wheat is where you see the highest amount of insoluble, and then some of those foods like bananas, rice, applesauce are where you see more of the soluble fiber, yeah. And then glutamine, I'm going to talk a little bit more in a bit, but glutamine is an amino acid, so a building block of a protein that we normally get quite a bit in our diet from protein foods, but sometimes under stress, illness, it can become what we call a conditionally essential amino acid, so we may not be able to get enough in diet. And so I'll talk a little bit about when we might want to supplement glutamine. Let me double check though, because make sure I don't miss it. No. Oh, okay, yeah, so I do have a slide on that. And then cryotherapy is simply ice therapy. So there are, you know, some like melphalan, which is a drug used for some conditioning regimens for stem cell transplants. There's small studies that suggest just sucking on ice chips 15 minutes before, during, and up to an hour and a half after can help reduce mouth sores. So again, these are some tips you've probably heard, some of them, but when eating is a challenge from a standpoint of what we call nutrition impact symptoms, so things that might be making it difficult to eat from treatment. Eating small, frequent meals is something we recommend all the time. Trying to get 20 to 30 grams of protein at each meal. This is the amount we see that helps maintain muscle, weight, immune function. Potentially even that amount of protein with ginger can help with nausea, or may help with nausea. So you see some examples there. Ways to get 20, 30 grams would be potentially a protein drink smoothie, a three egg omelet. A typical chicken breast would give you that amount, 3/4 of a cup of cottage cheese, so it's not too hard to get that amount, but getting that at least 3 times a day. Consuming nutrient-dense liquids, oral nutrition supplements, commercial or homemade. Are you familiar with all the new lower sugar, healthier versions of nutritional supplements out there? Orgain, Enu, Kate Farms. So a lot of times when we talk about this, people are concerned, rightly concerned, about the sugar and some of the ingredients of some of the commercial products. So those are a few examples of newer ones on the market that some of them are made with vegan ingredients, organic ingredients. So if you don't want to make your own, a little higher quality products out there now. So protein and calorie you would get from some of those drinks, but sometimes just adding non-fat dry milk, coconut oil, canola oil, avocado, you know, mixing in healthier high calorie ingredients to your food to boost intake. Using a straw, sometimes that can help if the mouth is sore or with taste changes. Avoiding acidic, spicy, fatty foods. I mean, these are things that are harder to digest. Staying active, sometimes people forget activity can stimulate the appetite and maintain muscle. Flipping meals to the best time of day, so often people will do better at breakfast and eat a bigger breakfast. Consuming foods at room temperature, particularly if smells are a problem or nausea are a problem. And then trying to get more omega-3 fatty acids, and I'll talk about why omega-3 fatty acids potentially. There are a lot of reasons to consume omega-3 fatty acids from a heart health standpoint, but at least 24 small clinical trials have shown benefit of fish oil for preserving weight and lean body mass during treatment. So eating cold water fish is one way to get omega-3 fatty acids: salmon, trout, sardines, tuna. But again, you'd have to eat a pretty big piece of fish every day to get the amount that has been used in these studies to show benefit. So generally we recommend supplemental omega-3 fatty acids. You can get some from flaxseed, but it's not the same. Walnuts, chia, you know, so again, I guess if you sprinkle a lot of this in the course of a day, you could get a significant amount, but the best source of these omega-3s is fish or fish oil supplements. I don't know if anybody in here taking fish oil supplements? Okay, yeah. So, this is another one depending upon why you're taking it. So if you're taking it for heart health, you want about 1,000 milligrams or a gram. And then if you're doing it for weight and body mass, lean body mass preservation, it's a little higher. It's 1,500 milligrams or 1.5 grams. But anything I suggest I talk about here today, you really should review with your healthcare team, your oncologist, your primary care provider, because these are general recommendations, and there are always individual circumstances where they may not be appropriate. Nutrition support, so I just put this in here because sometimes people actually ask about IV nutrition, and it's one of those things, if your digestive tract works, you really should use it. From that gut microbiome standpoint, I said, but it's a muscle, it's a smooth muscle, so it's like other muscles, if you don't use it, you lose it, and it loses function. So always trying to make sure we get it down this way instead of through an IV. Then there actually are studies done in stem cell transplant where comparing individuals who either eat and or are fed through a tube into their digestive tract compared to IV nutrition. And again, this is specifically in the stem cell transplant population, but much better outcomes if you're using the digestive tract versus through the IV. So that's always a last resort. So here's the glutamine again. I mentioned it's an amino acid, the building blocks of protein. It's important for the immune system, the digestive tract, muscle cells. And I said, we can make it, we consume it, but it is considered a potentially conditionally essential nutrient where under times of stress, illness, we may not get enough, and we may need to think about a supplemental source. So it can help with diarrhea from treatment, and it can also help with mucositis or mouth sores during treatment. Again, small clinical trials with glutamine have showed it can decrease the use of pain medication, risk of graft versus host disease, incidence of mucositis, diarrhea. Again, here's my caution, use only under medical supervision. But generally there's, most of the literature, most of the studies have been done with 30 grams in divided doses in, like a few ounces of water or juice 3 times a day. In the transplant setting, we usually start day 0 and then continue through engraftment for these indications. Vitamin D, who hasn't heard something in the news recently about vitamin D, right? Everybody, so in healthy individuals, we know deficiency and insufficiency is a huge issue, particularly here in the Midwest. We're getting ready to go into the October to May season when we can't make vitamin D with our skin, so we need to be concerned about that. It's hard to get it through diet. We're not going to get it through sun. So here's another example where supplements may be indicated. So here's just, there's a wealth of data in this area with vitamin D and blood cancers. So we've seen data that deficiency may be associated with poor event-free survival and overall survival in some B-cell lymphomas and T-cell lymphomas. Some trials have actually found high prevalence of deficiency, vitamin D deficiencies, and that those levels were associated with poor survival. Yes.
What do you consider vitamin D deficiency?
Wow, that's about one of the most controversial topics we deal with. The guidelines that have been accepted by the scientific community are 20 nanograms per milliliter, so a level less than 20. Although there is some literature to suggest 30, 32, some people even look at higher cutoffs, but the official answer is 20. Based on the latest National Academy of Sciences report. But if you see here, some of these studies, people were a good number of people were less than 8. That's a level nobody would argue is deficient.
Right.
Yeah.
But mine is around with supplements that I'm taking, like a fair amount of supplements. It's around 30 or 32,
Mm-hmm.
and both my oncologist and my primary physician seem to think that, that's fine,
Mm-hmm.
but I've read other things that would indicate that much higher levels of vitamin D can be advantageous for leukemia.
Mm-hmm. Yeah, it's a very controversial area, and some trials look at more active vitamin D, which is different altogether from a standpoint of response. And so depending upon what you're reading, there are studies using an active form of vitamin D, not the type you would take in a supplement. But how much are you taking? How much supplemental vitamin D are you taking?
I alternate days between 2,000 and 4,000, and then one day a week I take 5,000.
Okay, so it's a pretty good amount. Yeah, it's very individualized, and if your oncologist and physician are comfortable there, it is in the normal range based on the latest recommendations, and it certainly is high enough where you're not in the area we're seeing in the literature that's associated with.
Right, I realize
yeah.
it's not
Right.
awful, but
Right.
I was wondering whether higher might be better.
Mm-hmm. Yeah, we look at this pretty routinely every 6 months or so. In fact, tomorrow we have a group looking at this, and we were, this is just my opinion, okay? So we were a little disappointed when the recommendations came out saying 20, but again, they were looking at it more from a standpoint of bone health, and the literature in cancer is not definitive yet. We generally 30, 32 is where we sort of have been using as a cutoff for many years. So would I recommend a supplement for somebody in that 20 to 32 range? Yes. But higher, I don't think the data's there yet to recommend levels a whole lot higher. And sometimes we have to be careful with the literature too, because depending upon, so you'll see it reported in nanograms per milliliter, you'll see it reported per deciliter, you'll see different units. And so sometimes that gets really confusing too, because I've had people, actually professionals, bring something, this says 40 to 60, and I said, yes, but that's a different unit of measure, so you have to convert that, and then it's actually more in this 30, 32 level. Does that make sense?
Yeah.
Yeah.
Is there anything that could be harmful about taking too many supplements?
Yes, vitamin D is one of those where it's fairly, I shouldn't say it's easy, but there are concerns with toxicity. And I actually, Tom mentioned I worked at the University of Wisconsin. When I worked at the University of Wisconsin, I had somebody with a very severe acute vitamin D toxicity, and it can cause calcium deposits in your soft tissues. I mean, it would problems with the liver. This person was seriously ill and actually got it from milk, just drinking too much milk. Yeah, so it is one where actually, vitamin D is not unique. All nutrients have this like bell-shaped curve, right? And that's how we determine recommended amounts, where there's a window of ideal intake, and too little causes problems, and too much often causes the same problems. So, but yeah, I think, I certainly wouldn't recommend anything different than your oncologist. And 30 to 32, even, where I practice, we would consider normal, and probably would recommend similar amounts. But again, it's one of those things we watch, and we even update our recommendations every 6 months or so, because it rapidly changes in this area. But I think the biggest problem here is the literature reports vitamin D levels with different units. And so sometimes it looks like 40 to 60 is ideal, or maybe 70 is ideal, but it's actually not reported in nanograms per milliliter. And when you do the conversion, you're actually more consistent with that maybe 30 to 40 amount. Not controversial at all, right? And vitamin D is another one in the future. We will probably learn people have what we call, single nucleotide polymorphisms, or changes in their genes that affects, the vitamin D receptors, and it won't be a one-size-fits-all recommendation, but we're not quite there yet.
And presumably the absorption of the supplements is different depending on various factors?
Right, right. I mean, it's a fat-soluble vitamin, so it is absorbed better if you take it with some fat. So it is one you want to take with a meal, and ideally a meal where you've had some fat versus on an empty stomach. So I don't know if you've been taking it with like a heavy meal, but that might help.
Oh, okay. I'll try that. Thank you.
And I mean, and not to get real controversial here, but trying to switch brands. Because there was an interesting study done not that long ago, actually showing difference in response based on brands. Because the whole and one of your resources on your resource slide is consumerlab.com, which is an independent company that pulls supplements off the shelf and independently tests them. And of course, it's all over the place, the results. So it's getting better, but sometimes what's on the label and the amount isn't exactly what we find in the bottle. So I don't know if you've been taking the same brand for a while, but switching brands, sometimes people respond better. So.
Do they rate
Yes, Consumer Lab, yeah. You can get some information free, and then for a small subscription, you can get all the testing they've done. They have an encyclopedia, a nutrition encyclopedia in there that's excellent. You can look up almost any supplement and what the literature says. So I'm on there almost every day. And I haven't had somebody say they didn't find it helpful. But taking with food where there's some fat and switching brands might be something to try and see what happens. But again, I think that level, I wouldn't be concerned about that level. These levels you can see are pretty low here.
Right.
But again, if you haven't, anybody here not have their vitamin D level tested? Okay, so if you had it tested and you're recommended a supplement, take the supplement and then retest. Most primary care doctors now are testing annually, so because the data is so prevalent that we have a deficiency, insufficiency issue, and it affects all kinds of health outcomes. So after transplant, ideally we try and get people eating that healthy diet as soon as possible, but there are some unique things after, particularly an allogeneic transplant, graft versus host disease. Have you all heard of that? Or I won't talk too much about this because it's, doesn't affect everybody, but these individuals, can have a very severe digestive reaction where it becomes very challenging to eat. And certainly they cannot eat those plant-based foods for a period of time. And that's where we may need to do some nutrition support with either feeding through a tube. That's where IV feeding may be appropriate. These individuals have to be careful with lactose from dairy products and other foods, low-fat, bland. Here's where we're actually kind of recommending all the unhealthy foods that we talked about avoiding, just to get them through this period, and then we progress more towards a regular, healthier diet. So usually this is only relevant if it applies to an individual that's had an allogeneic transplant and had graft versus host disease. So these are some of the resources I mentioned. The Leukemia Lymphoma Society actually has access, I think it's in the bags I saw, to dietitians, to nutritionists.
Yeah, we have a nutritionist that you can set up a meeting and have an hour consultation one-on-one with a nutritionist. And I put that brochure in your bags.
And it's by phone? Is it by phone or?
Yes.
Yeah. Okay.
Yeah.
Okay. And then the Academy of Nutrition and Dietetics at erat.org. There you can find one as well, and ideally one with an oncology specialty so that they have had some specific experience. Because if I had to take care of somebody with something else right now, I wouldn't be very good at it. So somebody that is an oncology dietitian or an oncology nutritionist. I mentioned the American Institute for Cancer Research, the National Cancer Institute, and that Consumer Lab for supplement reviews. I guess I missed the environmental working group, but I think it's ewg.org. Or if you just Google environmental working group, you can get access to that. Dirty Dozen, Clean 15. They also rate fish, from a standpoint of the best fish. So really, really good resource there as well. And then at that, I'll take any additional questions you have of the group, and certainly I can stay afterwards for one-on-one questions. Anybody